Good morning, good afternoon, and good evening, everybody from around the world. And thank you for joining us on this first symposium for 2025, the January HITLAB Symposium on Digital Health Evidence Diffusion. My name is Stan Kachnowski, and I am chairman of HITLAB, and will be hosting and helping you navigate the program today, walking you through an update on what happened at JP Morgan Healthcare, what's going on in the world of digital health when it comes to a lot of the funding freezes and unfreezes that we're seeing from the US federal government. We're going to be talking about the world of digital health and apps from Europe and from our chairman of the Breakthrough Alliance European Board, Laurent van den Berg. And then we're going to be jumping into having a review of JP Morgan and what people saw there. Laurent will be talking about that as well, as he was also at JP Morgan. And then we'll be getting into toward the end of the first hour today, talking about breaking barriers in women's health with the global BTA Breakthrough Alliance board member, chairman Bill Toronto, talking with a digital health leader from Mount Sinai School of Medicine. We'll be winding out the first hour with someone from Digital DX Ventures, Michelle Colucci, and hearing from her and her perspective there. So we've got a busy day today, and obviously there's a lot going on, not only in healthcare, but in digital healthcare. The second hour will have an interview with someone from the Multiple Myeloma Research Foundation. We'll be hearing from them about their philanthropic ventures and some of their updates from JP Morgan as well, what they're seeing for the not-for-profit community and how JP Morgan conference helped out there. And then we'll also be talking to Savan Devani from the company BioTrillion. And Savan's been working for a few years now in developing literally a digital doctor that can sit in everyone's pocket. He's also the recent winner of a Breakthrough Alliance champion competition. And then we'll be winding up with one of our favorite folks, Matthew Holt, who is the founder, author, and digital health thought leader for a few decades now out of Silicon Valley, and who leads the healthcare blog. Matt Holt is going to be talking to us about some of his perspectives from the JP Morgan conference, really festival, since only about 3,000 people go to the actual JP Morgan conference and about 100,000 go to the overall San Francisco environment during JP Morgan. And then in the last hour, we're going to be talking to some extraordinary leaders in digital health who are leading right now companies that are transforming healthcare and growing at an incredible rate month over month, year over year. First, we'll be talking to the head of the Proficient Lab from New York City, Unica Alexander, and we'll be talking to her about what she's seeing with AI and digital laboratories. And then we'll be talking to Grayson Robinson from Renova Health, who's reinventing how people can actually modify and renovate their homes after or even before any kind of a life crisis, so they can age in place in their homes forever. And then we'll be talking to Tim Liu, who's from Silicon Valley Bank, and hearing about his world and what he's seeing from JP Morgan and some of the healthcare investment trends that he's seeing and exits that he's hearing about as well. And we'll wind up with Buzz Stewart from Medcurio, again, a revenue positive digital health company that's transforming healthcare for all the good by creating health exchanges within large enterprises and really leading the way for AI and automation in healthcare data for large healthcare institutions. So that's the agenda over the next 3 hours. We are going to be very busy. We also are one of the few environments where our community chat is open. So please do pop in your LinkedIn, introduce yourself to the community on the chat within Zoom here. And if you're not already, please do remember to subscribe to our YouTube channel, our LinkedIn page, Twitter, Facebook, Instagram. Get involved in our social media groups. They're all very active, and we want to help create a better connected ecosystem, because what we find is that a better connected ecosystem leads to a more efficient ecosystem, more transparency, and much better decision-making when it comes to finding and evaluating and engaging and then contracting and implementing digital health technologies to help improve patient care and help improve medicine development for patients.